Hello there. I'm here today to talk about our study which has looked at how COVID-19 has affected the quality of life, well-being and care of people diagnosed with dementia and their family carers. The aim of our study is to understand the quality of life and care implications arising from the COVID-19 pandemic on people with dementia and their family carers. We have, as part of this study, a lived experience advisory panel, so a group of people with dementia and their carers, and that group has been set up as an integral part of the study. So the group has helped us and helped us with the study design, some of our study documentation, our topic guides for our interviews, helped us to review our interim findings, and also supported our dissemination activities. We hold regular meetings with the group using Zoom. And what we have now is a video of three members of the group, so Julia, Claire and Tina, talking a bit about why they got involved in the group, why they think it's important for people with dementia and carers to be involved in research, and some of their reflections on our interim findings.
Hello, I'm Julia Fountain and I'm the coordinator of the Dementia Consultation Group at Sussex Partnership. And as part of that, we run specific study groups called LEAPs for each different study. And I've also got with me Claire and Tina, who are part of the Lived Experience Advisory Panel on the Time for Dementia COVID-19 study. So I'm just going to ask both Claire and Tina some questions. So the first one is really just to ask, how and why did you get involved in the LEAP and our work? So should we start with Claire?
Okay, yes, I'm Claire and I live with my mother Doris, who was diagnosed with mixed Alzheimer's and vascular dementia back in 2012. And it's been a gradual journey, obviously getting more demanding as time goes on, but because of the isolating nature of life trying to care for mum, I decided to join a patient participation group at the local GP because the amount of information I was getting from different sources was extremely confusing. And I wanted to learn a little bit more about the process. And actually from that, I then met someone who was very actively involved in the research study that we're talking about now, or research studies, and that was my journey.
Hello there. Yeah, my journey was slightly different from the memory clinic. We've only been known for a year that my husband has got Lewy body dementia, and it's been a very much faster process than Claire has experienced. The memory clinic sent us on to the drug trial, which we went through, and the doctor that was running the drug trial was involved with Time for Dementia and Brighton University, and has just invited us across. So that's how our involvement. Like Claire, there's an enormous amount of information that you've got to take in very quickly, combined with the grief, the shock, and all the other emotions that are going on inside you. So it's been a difficult time, but it's been good to get involved with the drug trial and with the Brighton University.
So secondly, do you think it's important to have people with lived experience involved in research? So again, if I go to Claire first.
Extremely important, because it's only when you actually become involved in life, as in helping to care for someone with these conditions, that you can actually appreciate all of the challenges that there are involved. I don't think I had any idea at the start of my journey how things were going to pan out. So therefore, having the opportunity to influence studies that will inform the process of helping to deal with these conditions is absolutely amazing, because I feel that I am contributing to the journeys of people that are going to come after me in helping to care for their loved ones in such challenging circumstances.
I can completely concur with Claire, absolutely. you as researchers have to understand really what it's like for us at the coalface. It is relentless and exhausting. And for you to understand what we are going through, even by just telling you, it's important for us to tell you, and important for you to hear what it really is like. So I can't say anything more than what Claire has just said. It's very important.
Thank you. And so lastly, I just want to ask, did anything for CHIME, particularly for you and your own experience with the findings from this study? So again, Claire.
Yes, certainly. When COVID kicked in and we gradually withdrew into our own little worlds, everything for me stopped. And the most important thing of all was the respite. That was my relief, my period to be able to recover, so that I could carry on caring for Mum in the way that I wanted to. And all of a sudden, no respite. Where do I go from here? I had to carry on, and I think it's taken a toll on both of us. So yes, the study did reflect how services stopping impact at the coalface.
Yeah, it was huge. It was like falling off the edge of a cliff. Our routine changed, and the whole point of somebody suffering from dementia is they need routine, they need calmness, and suddenly that safety net of what we had created around them, their routine, had completely finished. So as Claire said, it had a huge impact on our daily lives. And reading Steph's report, I couldn't believe how much I resonated with a lot of her findings, a lot of what had been said. It was quite an emotional document to read, because I just could see so much of me in that report of what we are going through. So it's almost validated our emotional roller coaster in a way.
So, having heard about our lived experience group, I want to mention something very briefly about the Time for Dementia study, because our COVID study has been nested within Time for Dementia. Time for Dementia is both, it's a novel education programme for undergraduate healthcare students that's running across Kent, Surrey and Sussex. In the programme, students have contact with people with dementia and their carers over about a 2-year period, with the aim of it providing knowledge and information to them about what it's like to live with the condition and how it changes over time. We've been carrying out an ongoing research programme looking at family and student outcomes. And at the time of starting our COVID study, we had 350 family carers taking part in our Time for Dementia study. So in order to sort of be pragmatic, our study was set up, we made an application at the beginning of April, and the study was set up by the end of April. So we wanted to be quite pragmatic in our study design. So we looked to use the Time for Dementia study so we could look at a longitudinal study, but also build in some mixed methods. And what we've done within our study, so we've looked at this sort of group, a pre-existing group of 350 family carers who were already in our Time for Dementia study, already had completed quantitative measures looking at quality of life and well-being, and obviously in terms of design, all of our baseline data was undertaken pre-COVID-19. What we then did was a second round of data collection specifically for our COVID study. So we undertook measures in May and June of this year, and we were able to recruit 250 family carers to the study, and we also undertook 12 interviews. And our plan is over the next 2 months, so over October and November, we'll be following up on the quantitative measures with our cohort of 250 carers, and also going back to the people that we've interviewed to do further qualitative interviews. In terms of outcomes that we've used, so our main outcome was the CDEMPOL measure, which looks at quality of life in carers of people with dementia. We've also used DEMPOL Proxy, which is a proxy report of dementia-specific quality of life in people with dementia. We've also looked at the SFDEM that looks at social functioning in dementia, and that again is a proxy report. So all of our data collection has been with family carers, mainly due to the challenge of undertaking data collection remotely or over the telephone with people with dementia, and the challenge of assessing capacity. The final measure that we've used is the CDR, so the Clinical Dementia Rating Scales, and so that looks at 6 areas of cognition and functional ability in dementia, and again that's through a proxy report. Just to sort of add that within CDEMPOL, so it's one measure, has 30 items, there are 5 factors that make up that measure. So there are 5 elements that we found to be significant in quality of life of carers with people with dementia. So those are feeling supported, the relationship between the person with dementia and the carer, meeting personal needs, so the carer's ability to meet their own needs, confidence in the future, and overall carer well-being. And that's something we'll come back to when I talk through some of our preliminary results. In terms of qualitative interviews, so we're planning to do repeat interviews, one lot in May and June, and the second wave in October, November. Our questions very much are focused around the experience of COVID-19 lockdown and the identification of factors that either have sustained, improved, or compromised quality of life during this period. So, realising that not all of my slides are very clear, but this is just a very brief overview of the characteristics of the 250 people that we consented to the study. We actually took measures in the end for 248 participants. So, sorry, the first column here is person with dementia, so a mean age of 77.47 years, and the second column relates to carers, the carers being a little bit younger, an average of 70 years. We had predominantly male, the people with dementia were predominantly male, and conversely, predominantly female carers taking part. Very little diversity in terms of the background of participants. Marital status, most of the participants were married, and most of the participants weren't currently working. Specifically in terms of the person with dementia, so we had a range of diagnoses or types of dementia, with not surprisingly Alzheimer's disease being most prevalent, and also mixed dementia. And we looked at illness severity from the CDR, with again most of the people in the study, so 42% having mild dementia, that 29% having moderate dementia, and a much smaller proportion with severe dementia. So in terms of what we found, one of the first things we did was to look at change between time. So we looked at the data that we had, that people had completed prior to the COVID pandemic. So that there was a variation in data collection, but really anything up to about a year before COVID had started. So we looked at that data at so pre-COVID and then during lockdown. And what we saw, although you can see change in some of the scores in terms of statistical significance, in the overall scores for DEMPOL proxy, so that's quality of life of the person with dementia, and CDEMPOL, which is quality of life of the care of the person with dementia, we didn't see significant change. However, with CDEMPOL, when we went to look into those 5 domains that I mentioned previously, where we saw some significance or statistical significance, the first one was meeting personal needs, that we saw that had decreased significantly for carers of people with dementia, that domain. And secondly, and this is obviously from the carer report, that the carers rated their relationship with the person with dementia less positively during the lockdown period compared to sort of pre-COVID. So those in terms of some of the change scores. I'm not going to present too many statistics today, but we also have looked at some regression models. So what we've been looking at is associations between different variables. So we've looked at things like gender, relationship type, and living situation. So what we've seen in terms of some of these associations is that for quality of life in carers of people with dementia, living with the person with dementia seems to have a negative association with carer quality of life. In terms of the quality of life of the person with dementia, it seems from our data that the female carers reported lower quality of life of the person with dementia at follow-up. So females reported that at a lower level compared to male carers. And in terms of social functioning, female carers again reported higher levels of reduced social functioning in the person with dementia. And also we saw a relationship between lower or poorer social functioning in the person with dementia and spousal carers. I'll move on to talk a little bit about some of the qualitative findings that we have emerged, because some of those do corroborate what we're beginning to see in our preliminary data. So we carried out 12 interviews. 4 of those were with resident spousal carers, 1 of whom was shielding. 4 interviews with non-resident carers, again, 1 of whom was shielding. We looked at carers of people with young onset dementia, and we also looked at 2 resident but non-spousal, so adult children carers. We interviewed 5 male carers and 7 female carers. Predominantly, the carers were from a white British European background, and the average age of the carers that we interviewed was 61 years, although the age range went from 47 to 79 years. So in terms of some of the things that we found, so we asked carers about life before COVID. Carers were generally fairly positive looking back, talking about the fact that there was often, most of the carers we spoke to talked about having some support, some freedom to do some of the things that they wanted to do. When asked about the quality of life of the person with dementia, the carers talked quite a lot about the person with dementia having connections with others, having opportunities to be doing things, to have things going on, and also receiving support. And the carers, not surprisingly, reflected on life together, so life between the carer and the person with dementia. And the majority of carers that we spoke to talked about having quite a full life, having a regular routines with joint activities, connected with others. And some of those dementia support services that people might use for things like dementia cafes sort of served a dual purpose, both for the person with dementia and the carers, in terms of meeting other people and having that connection. However, again, the majority of carers talked about the fact that regardless of the fact that we have the COVID pandemic, everything that's happening to them is in the context of a sort of general progression of dementia and the impact of caring with dementia. So life at times can be tricky anyway. In terms of the impact of COVID-19, so what carers talked about specifically was a lack of freedom, feeling that they'd lost control, at times the situation feeling a bit suffocating, and really not having a break away from the person with dementia and therefore not being able to meet their own needs. Many of the carers talked about the strain it was having on their emotional well-being, so feeling either anger or sadness, feeling exhaustion, or maybe being low in mood, or at times feeling quite guilty. And that guilt often was feeling that they weren't perhaps being able to look after the person with dementia, as well as perhaps other skilled workers might be able to do. So if somebody with dementia went to respite and they couldn't be doing that, the carer often rated themselves as less good compared to sort of formal carers, either feeling too worn out sometimes to be sort of thinking of trying to think of activities or things to do. Many of the carers sort of talked about what a challenge it was to find activities to do, particularly when some of the usual avenues, not just support, but cafes or things that they might usually do might not be open. Younger carers, particularly adult children, talked about role conflicts of perhaps having children or indeed grandchildren that they were trying to look after, trying to manage their jobs, maybe having other family members who were shielding because of COVID. And for some non-resident carers, actually perhaps getting more involved in the care of the person with dementia, but I don't know, the need to do shopping or so on. And I guess a sort of general sense that there was less support around for people, and carers feeling increased responsibility themselves for the person with dementia. In terms of the impacts of a person with dementia, one of the challenges for carers was that often many of the people with dementia were struggling to understand the pandemic, the need for restrictions, why people weren't able to visit, and what carers talked about was the need to sort of constantly either repeat or reiterate that information. However, there was a suggestion that maybe this was more impactful for those with less advanced dementia. So perhaps people with more mild dementia, having more awareness and feeling the loss of that sort of social connectiveness. Again, some suggestion that people with young onset dementia, it was more challenging. They were losing more of those supports. It wasn't always obvious to other people that maybe that people had dementia, and certainly an impact on mood and restlessness. Also, quite a lot of concern about a lack of stimulation. So generally thinking that the person with dementia is less engaged in activities, less motivated, and a perception that this was having quite an impact, along with that lack of social connectiveness, on the cognitive decline of the person with dementia. So a sense that perhaps they were getting worse because there was less sort of keeping their mind motivated. And also, last thing that came up consistently was a concern about the decreased mobility in the person with dementia, because perhaps they weren't going out as much, able to do as much. The fact that they were sitting down a lot more, they're often having more aches and pains, more pain, and not finding it very easy to get help for any of that. So a real whistle-stop tour today of some of our findings. Some of the considerations are clearly one of the big limitations, largely white British sample and mainly spousal carers, a convenient sample at the time for dementia studies. So obviously these findings are not necessarily representative of everybody with dementia. It is a naturalistic study, so we can report associations, but we can't say for sure quality of life is getting worse because of COVID, but it does give us some data to explore some of these outcomes. And what we hope to do with more data is to look more at some of the possible associations in the data. We've just started data collection. Our original aim for this study was that this second round of data collection would be post lockdown. Again, it's, as we all know, things are quite uncertain, and it's not clear whether we will be, some of this data will be yet more of a lockdown, or in fact the fact that generally a number of people with dementia have continued to sort of socially distance, even if they're not in the formal shielding group, just because of a concern about the implications of healthcare and physical implications of COVID. Also, all of this is in the background, quite a lot of disruption and uncertainty with dementia services. And although the lockdown did finish earlier in the summer, a lot of support services are not being delivered still. So the picture is quite mixed. And also within our data, we don't have a lot of input in terms of interviewing people where the person with dementia is in a care home. And that is something that we hope to address. And we will be carrying out further data collection in October and November. That's it from me today. But thank you very much for listening.